And we're live. Hello, welcome back, everyone. I hope you had a wonderful holiday season. We're excited to be back for our weekly series starting at Thursdays again. Or you might notice the time is a little bit different, but we'll see how it goes. We'll see if you guys prefer the 1 o'clock Central Time or a later time. But I'm excited to dive into a different topic this week. And it's all about exploring cannabis beyond pain and what that means regarding to mental health. And as always, I have Dr. Kennard here with me today, and he is very versed in this topic, and I'm sure he's very excited to share case studies and talk all about mental health and how that relates to cannabis.
Yes. Thank you, Brittany. I'm glad to be back. We're into a new year, and Pulse Pain and Wellness is prepared to make adjustments like we need to keep this going and thriving. And so there's some exciting things that we are implementing this year to take kind of the next leap for our patients. And it has everything to do with mental health, behavioral health, and psychology, and how cannabis kind of ties into that, and what to do if cannabis falls short of all of those goals.
Yeah, absolutely. Because people, they think about getting their medical card primarily because they're in pain. They're in chronic pain and they can't find any relief. However, cannabis is also great for so many other things that you might be considering to get a card for. And one of them is mental health. And even though there are some guidelines on what those boxes you can check to get your card regarding mental health. For those who do already have your card, there's some amazing benefits from that. So, Dr. Kennard, can you discuss, maybe any recent studies or findings that are highlighting these potential benefits of cannabis and managing mental health conditions beyond that pain relief?
Yes, I can. So my primary practice of medicine since I finished my training was chronic pain management. And so I think everybody's clear of that, but just for reference, when you treat chronic pain, you treat the secondary and sometimes 3 and 4 other conditions that kind of follow suit with someone that has to live and cope with chronic pain. And so those can be very disruptive outside of the physical pain that they're dealing with. The fact that they have physical pain has caused them a disability, their inability to do something they enjoy or work or any of that can cause a lot of stress. Their pain can cause them to lose sleep, which, when you get behind in, can affect lots of your body systems and just really get you discombobulated quickly. So obviously, being disabled comes with some degree of mood depression because you're limited, and the physical pain can cause some transgressions and some anxiety and mood depression. So the thing is, I'm trying to make the point that although chronic pain is one of the listed conditions, there are many what we call secondary pain behaviors that are common that aren't addressed by pain medication or any of these fancy nerve blocks or ablations or things that interventional pain management physicians are trained to do. You have to, or you don't have to, you should respect those other entities along with treating the physical pain. So what do we do though? If you don't have chronic pain and you just have anxiety, depressed mood, difficulty sleeping, since those aren't currently conditions you can get a card for, we are seeing it and having it reported as to helping those things in our chronic pain patients. So it would make sense that it would help anyone. And we have the data to show that many people that just have anxiety or just have trouble sleeping benefit from CBD and THC. So
yeah,
the studies are there, but my experience is also there, and between the two, it's undeniable to me that it has a chance to affect all of that. But how do we get around the diagnosis right now? So what I've got to announce is that the legislature is in all likelihood going to take up adding some additional diagnoses, potentially anxiety and insomnia, to the conditions list. So the first quarter of this year. I hope they do. There was a cannabis task force committee meeting, which is a group of people that from the Department of Health and physicians and clinicians and people from the industry were tasked by the Medical Cannabis Act to form a committee to report to the legislators about how the program's going and any recommended changes they may have. And that was one of the ones that passed as a yes, to consider adding some additional diagnoses. So that's good. So you can maybe look forward to not having that barrier. But in the meantime, if you do have one of the other qualifying diagnoses, what we're seeing in our patients is they're reporting benefits to sleep and anxiety readily, so we know that there's a place for it.
Mm-hmm. Yeah, absolutely. And I know you talked a little bit about how when people are having, chronic pain, it's affecting their mood. And that's so true, because if you're in constant aggravation, you're not going to be a happy person. And there's definitely some relief there with cannabis. And I'm curious, how does that cannabis interact with the brain to alleviate those symptoms associated with mental health and potentially mental health disorders? Is there specific cannabinoids or terpenes or other factors that play a part of the cannabis plant that are firing receptors?
Yeah, so that gets into the technicality of the dosing and formulation and all those things that you would need to be aware of. And what we're trying to do through our clinics, without overwhelming patients too much with the technical details, is guide them towards really specific tailored plans for what their goals of treatment are. Mm-hmm. So a diagnosis is one thing, and then your goals of treating the symptoms of diagnosis can differ for the same diagnosis. Taking anxiety, everybody can really relate to what that means to be anxious. So that's a good place to start, just with that term. But anxiousness comes in different flavors. There's a lot of times that individuals don't even realize how stressed or anxious they are. Mm-hmm. Others may see it. It may present itself as frustration or short temperament or lack of sleep, but you don't know it's stress or anxiety yet. So what we plan to do at Pause is administer some kind of tests to kind of sort that out. And they'll be probably as enlightening to the patients as they are to our practitioners, because they just may not realize, hey, I never would have thought I would register high on an anxiety scale. Mm-hmm. But that's the kind of level of treatment I think patients need before you decide what to take or what treatment plan to implement. Let's find out which anxiety patient are you, obviously what you've tried and recognized and failed, and then what's the best. So that brings strain into mm-hmm. the conversation, the strain of cannabis, and indica and sativa, and then a combination of those two called a hybrid are your three main strains. Okay, one of them is a combination of the other two, but that is a very important starting point if you're trying to treat someone's anxiety symptoms with cannabis, is that you've got to start with strain. So mm-hmm. indica is the strain, and a lot of the products are made of this. So again, you don't have to smoke it to get one strain or another. All the products are usually made with one strain or another, a combo called a hybrid. So you're talking about the drops on your tongue, or an edible or an inhaled form. Strain, it doesn't select out for one of those forms. All the forms should have the capability to do this. So indica is the one that typically has a calming effect on the brain.
Yeah.
And the indica strain has different levels of and different CBD components, right, with the THC. So
Yeah.
without naming specific CBDs, you just know that indica has the composition of CBDs that typically would cause someone to relax or calm down or help with their sleep.
Yeah.
Sativa doesn't necessarily make you not sleepy, but it has more of a tendency to not make you somnolent or sleepy, and has more potential to kind of give you a little boost in energy. Anxious person being more anxious. So right there at that point of attack, choosing the right strain will matter.
Mm-hmm.
So a level of sophistication at our clinics, it's not too far of a jump for us to have that conversation with patients. And so that would be the first step. And then the timing of the dose and working your way into a dose and potentially to a hybrid that you could take during the day that didn't cause you to be anxious, but also didn't cause you to be too sleepy. Those are the finer points that you, after you initiate and do some trials, you can get to and settle in on a complete dose, a formulation which may vary from the nighttime to the daytime. Therefore, you need something with indica would be more appropriate at night if you're sleeping, and maybe the sativa during the day. So those nuances do come into play, and they are important. Um, and so
Yeah.
between us and your research and what you hear from the dispensaries and what you're telling them about what you're trying to treat, really that whole team should be able to get you a tailored approach.
Yeah, absolutely. It's really great how all-encompassing it is. Now, currently, with the state of research regarding the long-term effects of cannabis on mental health, is there any long-term studies? Where is this research side of things pulling these facts from? Or is it just basically, people from the community reporting on their effects and how much their mood has increased and, maybe mental focus or other mental factors?
Yes, the data on anxiety treatment is, like I said, there's a lot of it. And to say it's mixed is probably really fair. But why is it mixed? What I what I hope anyone that's looking at data, good or bad, for cannabis for any condition is that they are doing their best to separate numbers and reports on recreational use versus medical. And that's the tricky part of looking at studies. But in looking at the studies, if you do separate out typical medical dosing and formulations versus heavy, chronic, early onset use in a typical recreational user, you start to see the benefits more
Mhm.
outweighing the long-term risks. So what are some long-term risks of early, heavy, chronic use? This is where we see some slowed cognition. So your executive functioning is just not as sharp. It doesn't cause schizophrenia and it doesn't cause you to have a psychotic disorder. But if you have a psychotic type disorder, one of those can be schizophrenia,
Mm.
you'd need to be extra careful and monitored if you're going to consider cannabis for any reason, including anxiety,
Mhm.
because it could exacerbate the psychosis. So
Mm.
we are trying to screen for those conditions to make sure that we are not making something worse when we're trying to make it better.
Yeah,
Um,
absolutely. And I'm sure a factor of things go into that to not exemplify the psychosis, depending on what type of medications people might be currently taking for mental health. And regarding that, I mean, I'm sure that there's a landscape of accessibility right now to people who want to get a medical card who are strictly just looking to get it for mental health issues. Where are we at currently legally with that standpoint? I know you touched upon it briefly earlier on in this live, but do you have any foresight, or is there something in the works that people can be aware of?
Yes, I mean the conditions of anxiety, depression, insomnia, any additional conditions being added is in all likelihood going to take that legislative effort. So we're going to have to let that play out in the
Mhm.
legislature to get those conditions added, and that at the soonest would probably be end of in March, okay, of this year.
Mhm.
Um, PTSD is a qualifying diagnosis. So what is PTSD? PTSD is in a general sense a conglomeration of a lot of different psychiatric conditions like mood depression, paranoia, um, anxiety. So it's typically brought upon by a traumatic event. That's what separates it from just generalized anxiety or insomnia or just anxiousness or depression alone, just simple major depressive disorder, is that it was initiated um, by a traumatic event. But regardless, it comes with those symptoms, and it's indicated for PTSD to treat those symptoms. So there's an argument to be made that, and I think it's based upon the fact that they do have some decent studies for PTSD, that they may not have for anxiety and insomnia, even though we have a lot of good data that it's relatively safe. So if you and again, you may not know you have PTSD. You may not have known what I just said, that it's anxiety and insomnia and panic disorder all wrapped into something that was brought upon by a traumatic event. You just may not see it or appreciate it that way for yourself. That's why the questionnaires and seeing a professional can really sort that out. You may qualify for PTSD and not know it. We
Mhm.
encourage anyone that has anxiety and depression and has had any kind of traumatic emotional or physical event. It could be a death of a family member or a friend that you witnessed, or any kind of emotional trauma, to come and let us maybe help you get sorted out, or go somewhere else and talk to them about it and ensure that you have a proper diagnosis. Because if it is PTSD, they may implement some behavioral therapies or things, or may mention that cannabis could help. Um, and then we can kind of go from there.
Yeah, absolutely. And PTSD, I feel like that can also be chained to a plethora of other things such as anxiety, mood disorder, depression. It kind of all has a chain reaction, going back to, if you're in pain, you're probably not the happiest person. So there's
Right.
this whole body experience happening. And, that's why it's always important to make an appointment, check with your provider, see what we can do, because cannabis is here to help.
Right.
Now, where do you see the future of cannabis research heading in the terms of mental health treatment? And do you anticipate any breakthroughs?
Well, I'm not going to wait on a bunch of other people to do it. If I have to do it myself, I will. That's our attitude. And
Yeah.
I'm kind of joking, but I'm really not, because we have been certifying for over a year now, and it's primarily chronic pain. I'd say our probably most common secondary diagnosis is PTSD.
Mhm.
So there are a lot of people coming coming out to see if that is what they've been struggling with, and we do help coordinate an evaluation to see if you can be diagnosed with PTSD. Um, but we're going to start doing a little bit more for our behavioral health patients that may not currently meet the definition. If they have chronic pain or one of the other qualifying diagnoses, and they can get a card, but they really are struggling with the behavioral health aspects like insomnia and anxiety and depression, we're going to have a pathway for them
Mm.
to get a thorough evaluation and some treatment recommendations outside of cannabis. To complement cannabis, because you're going to have a lot of current users coming to get their card. They just want to be legal. And we understand that, and they have a systematic approach, and they don't have to take too much, and they know exactly when they need to take it, and they've worked it out with their employer, and there's no problems. They just simply don't want to get into a situation where they can't prove they have it legally. And they don't need a whole lot of help, but they may not know that they could benefit from more. We want to make sure that they're sure that everything's taken care of. Because, we're also not afraid to admit that cannabis is not the beginning and end of any one treatment. It's, in all likelihood, probably going to take a couple more people pulling the rope in different directions to get you completely well. So that's exciting. And then we'll be able to collect our own data. We asked the questions about anxiety and sleep already. So we are compiling that data. But when we incorporate our mental health telehealth program around this, we'll have more of an expert jumping in to monitor how cannabis is helping for different psychiatric disorders, even if it's not technically prescribed for that.
Yeah, absolutely. Well, thank you so much. Do you have any additional final thoughts about cannabis? Or for those who are watching, do you have any questions currently to ask Dr. Kennard? You can ask them now. Or if you're going to play this on a replay, just go ahead and put your comments below, and we'll make sure that somebody gets back to you. But final thoughts around cannabis and mental health, and how we can start to help people feel better, not only from chronic pain, but also on a mental level.
Yes. The whole purpose of a new drug available to treat anything is to give you more options, give a patient more options. If there were a single anxiety drug that worked for 99.99% of patients, we would have not much to talk about. But we know that's not the case. I believe that when dosed appropriately, cannabis is safer than a lot of what has been traditionally prescribed, especially the controlled substance nature for anxiety. And that doesn't mean that all patients that are on those are at some major risk. They may have it completely together and are responding well, and they don't need another tool. But I can just tell you from experience the countless number of people that are on those that aren't meeting their goals. So the idea is that we have a new tool. Let's implement it. And if we can make you safer by tapering off of one of those others that just hasn't really done the job, or you feel like it's more dangerous, or frankly has been more dangerous to you, then that's the beauty of it to me. It will not work 100% of the time in everyone. That's a little bit lofty and unrealistic. But I'm excited for people to have another tool when they've struggled so long with traditional. So I would just encourage people to keep opening your mind and learn more about it. And as this cannabis program in Mississippi grows, we're trying to help promote it in a healthy way. More clinicians are buying in. There are hospital systems that are getting comfortable with the idea because they've seen it roll out and the sky is not falling. There's a lot of positive behind this. I very rarely have a conversation that starts and ends or even has any negativity towards cannabis. It's usually excitement and just wanting to know more. Or somebody that's really perplexed that I'm doing what I'm doing and telling them that it's helping people get off opioids and benzodiazepines. And they're like, okay, well, I'm sad that it's the first time they'd heard it, but got to just keep it going and keep the program respectable and keep selecting patients appropriately and teaching them. And I think you're going to see good things from this.
Yeah, absolutely. And I'm very amazed by how the whole state of Mississippi is coming together. Mississippi voted for this to be legal. I mean, the majority of the population wants this to happen. And it seems like the community is stepping up into place to make sure people are feeling well, they're feeling healthy, and making such an impact, which is so awesome to see.
Yeah. All right. So you said final thought. I would be remiss if I didn't mention this. In selecting the appropriate strain form, dose, milligram CBD, THC before you even begin to get confused. Remember that unless a product can be labeled appropriately and have a certificate of analysis that it was tested for its ingredients, you can't trust what you're taking. And you will not get a gas station attendant to be as observant or reliable as someone that in a clinician's office or at one of these dispensaries. So I would just end with that not all CBD/THC is created equal. And you need to be careful about that. And so more to come on the regulation of that industry too, when the medical cannabis program is under such tight restriction, and there's basically no restriction on that. Caution ordering products that can't be proven.
Yeah.
So
Absolutely. Well, thank you, Dr. Kennard, for joining in for another Facebook Live. And then we'll be back next week. And it will probably be back to our regular tune time at 1 o'clock Central. But we are so glad to be back. And we got some very interesting topics coming your way to keep it fresh, to keep it exciting, and to keep you learning about cannabis. So stay tuned, and we'll see you next time.
Thank you all.